Hi, little birds! Coming at you with something I haven't really talked on my channel. Even though, you know, I am a transgender person, a trans woman, I have not talked on it. I have not touched on it. And why? I don't know. I mean, I've mentioned it, I think, in a few videos. Yes, I'm on hormones. And it's exciting. It's given me so much more happiness, and I feel so much more aligned with myself, with my being, and the hormones have really helped. So today's video is going to be talking about hormones and everything. You know, consult your right doctors, consult who you need to, do your own research as well. Because you always want to educate yourself. You don't want the doctor to be the only educated one in the room. Educate yourself on the drugs you will be taking, on the side effects, on the risks, on the benefits, everything. This is what I did before I transitioned. I probably spent a good solid 3 months just researching all the research that was out there and everything that I possibly could, because I wanted to do it safely. And the reason why I say safely is because I initially started it without health insurance, so I did not have health insurance to help me cover the cost of these drugs. And I was getting them from overseas. I got them from a couple sources that came very highly recommended by other trans women, other trans men. So I trusted these sites. There's many black market sites and other places you can get our drugs needed for transitioning, but these are the sites that I trusted, and I didn't have any issues with it not being in what was supposed to be in that bottle. And because I could crack it open, yeah, there could have been some differences. I don't know, but it helped. It definitely, transitioned me initially. And I can tell you that it must have been something other than Prozac, or, the little sugar cubes. So I started out, initially without a doctor or anything, and was getting it overseas, and I did my research. I made sure that I was safe doing it so that I was not completely unaware of what was going to happen. And I initially started taking estrogen, the blockers, and progesterone, which, I didn't really like the progesterone, at least what it came in. The one I was getting was called Microgest, and it always made me feel sick. And so to this day, I don't want to go on it just because it didn't make me feel all that good taking progesterone, and I'm not sure that it really helped or did anything, but yeah. So that's what I was taking, and sometimes I would have a lapse because I was waiting on it to come in, and it was overall very aggravating. And then last year in January, I got my first official prescription. I went to Planned Parenthood and, talked to them, and they were like, "Oh, you already know your stuff." And I'm like, "Yeah, I've been transitioning for a year now, and I looked it all up. I know the research. I know what's out there. I know what I'm wanting and needing." And so it made it very easy because they were like, "Okay, informed consent," and did it that way. And so the ones I am on right now, spirulactone. The one that tastes kind of minty. You don't want to taste it. It's rather nasty. And I take 2 of these one at night, one in the morning, and it does a great job at blocking testosterone. Let me tell you, because my first blood test to test, how much testosterone level I was down in 6. They were like, well, that's definitely within range, but you're below a regular female. I'm like, I'll take it. If it doesn't hurt anything, I'll take it. And then the other one I take, let's see, I also take finasteride, which is again another blocker, but I am not using it for that purpose. I am actually using it for its properties and helping with hair growth and helping your hair kind of come back, because I did have some spots where I was balding and I had an awful lot of hair coming out in the bathtub and stuff, and it just worried me. I was like, I don't want the male pattern baldness. I don't want to be bald. I want hair. And it doesn't affect the rest of your hair, so it just affects your hair on your head. And that's why I use it. So I take half a tablet of that a day. I usually take it at night, but it recommends morning, but it doesn't matter. I don't think so, as long as you take it at every 24-hour intervals. And then the last but not least, the most important one to me is the estradiol. And I take 3 of those. So I take 1.5 in the morning, 1.5 at night. And, I hear a bunch of other women that take a whole ton, and you don't need your levels to be, in the ridiculous. I've heard like 600, and it's like, okay, that's like the level of a pregnant woman. You don't need your hormones that high. Plus, if you have too much, that is bad too as well, because your body tends to take the estrogen and will convert it into testosterone, which is conversely the same. If you take too much testosterone, it converts it into a form of estrogen. So that's why you see people that abuse steroids with boobs, is because it's converting that into estrogen. So it's not really helping them because they're using too much. So that's why you need to be checked. You need to have your hormone levels checked on occasion to make sure you're in line, so that you're not getting too much, but you're getting enough that it does what you want. The feminizing, or if you're taking testosterone, you want the more masculine things. So, and I've seen great results. I can definitely tell my fat redistribution is really happening right now. I just measured a little of me, and I've lost, just in the last couple months, an inch on my waist, and then, it went to the boobs, which I don't mind. I'm really happy with that it's going to the breasts, because I would like them more fuller, and most of all, I would like some cleavage, because, you have them, but you want that visible sign. You want it to be visible, and I've always liked cleavage. It just shows, hey, you know what? I got breasts. You know what? Yeah. So that is what I'm taking. Now, not everyone takes all the same things. Most do. Overseas they don't use spironolactone. They take others. Oh yeah, and the modes that I take them, all of them I swallow except for the estradiol. I do it under the tongue. I can't say the word that it is because it's freaking complicated, but I take it under the tongue and dissolve it under the tongue, and my pharmacist initially was like, "Well, isn't it sour?" I'm like, "Not that I taste. I don't really taste it on occasion." Now, if I did the spironolactone like that, That would be awful, because one time it got lodged in my throat and my body chucked it up, and yeah, that taste coming up was awful. So don't take that under the tongue. Please don't. Even if your doctor tells you. It's so nasty tasting. It's ugh. So that is what I take. And again, everybody's journey is different. We all take sometimes different blockers depending on the country we're in. There's a couple other blockers out there, as well as, some doctors will prescribe progesterone along with it, which the research I've seen, it doesn't really help, and it increases your risk for heart attack, blood clots, and other potential bad side effects. So I choose not to be on the progesterone with the estrogen. I'd rather be safe than sorry and find out that, I might be at risk for those things. So be safe, be your authentic selves. Please subscribe to my channel, hit the like button, give me a comment, concern, love, whatever is on your mind. I'm open to it. Just be nice. Alright, bye guys.